if I might, I'm sure.
I'm actually
Okay.
going to I'm going to establish quorum right now. My apologies. Secretary, please call the roll.
Monta?
Here.
Monta present. Waldron? Waldron present. Agar Curry? Agar Curry present. Arambula? Arambula present. Wendy Carrillo? Wendy Carrillo present. Laura? Haney? John Sawyer?
Present.
John Sawyer present. Mingshein? McCarty? Joe Patterson? Joe Patterson present. Rodriguez? Sanchez? Santiago? Chavo? Weber? Weber present.
We will continue with committee members' questions and comments. I'll move to Assemblymember Joan Sawyer and then go back to you before Mr. Patterson asks his question.
Okay, and then maybe I can move this along by asking Mr. Calra to answer these three questions, maybe in your summary or immediately after, and maybe we can bring this down to a level that people who are listening hopefully can possibly understand from a consumer, just from people who have to use these. As you all know, or you may not know, I'm someone that has lifetime health insurance with the city of Los Angeles. At one time, I had double insurance with both the state of California and the city of Los Angeles. Many of you have seen me hobble around this building and other buildings with a knee problem. A knee problem that I've been working through with Kaiser for the last 6 months. So I don't know where you got your specialist that you can get to people in 29 days. And it wasn't until this pain got to a 10 plus level that I finally have gotten, and this is someone that has health insurance, I finally got somebody to tell me that hopefully within 2 weeks they can tell me when they can do the surgery. And I have health insurance. Let me say this again. I'm supposed to have one of the better health insurance. And every member on this committee, every member in this building, every lobbyist have seen me struggle for over 6 months with this malady. I just hope whatever we're doing will not increase the level of care that is needed for individuals, because you'll lose me in a minute if that is the case. The reason I'm going to go ahead and move this along and do the motion is that I want to continue this, because right now it's not working for me. And in 2 weeks, when I visit my doctors and they tell me another 6 months, I will lose it. And they will be calling LAPD on my ass, because I can't take it anymore. So that's one for me. I need to know that, and this is just for anybody out there that's listening, they just need to know whether or not this is going to improve their health quality of care once whatever we do, once this is done. Two, many of you know I have a mother who will be turning 88 on Thursday. It's her birthday. We just brought her back from the hospital. For seniors out there, I'm worried about their quality of care. Right now, I pay additional insurance for her so that she doesn't have to lose her home. We don't have to go into debt to pay for her, because she has diabetes, she's on dialysis, she has heart problems, and she's probably in the hospital once a month with some kind of emergency care. And if you think about that, just the dialysis alone could be catastrophic if we had to come out of us with out of pocket. So for those seniors who have ongoing medical maladies, we need to make sure we take care of them first. Yes, this is a nice esoteric discussion and budgets and big, but at the end of the day, I don't care. we got to take care of them. And the additional money that I pay for Medi-Cal and Medicare comes to like $600 a month. And I have insurance. So I pay another $1,000 a month for me and my mother so that we can have medical coverage on top of what the city of Los Angeles already puts in. So that's a real concern. And then lastly, when my mother first got sick, I remember getting her credit card bill that had close to $12,000 on it. I said, Ma, what the heck is going on? And it was for prescription drugs. It was for about 100 pills. My Lord. At $120 each or more, $1,000. I mean, it was ridiculous. The amount of money. It wasn't until we were able to get her into Obamacare at that time, that's how long it goes, that cost would have been incurred for her for the last 10 years. So prescription drugs and that cost is just as debilitating for people out there, whether you're poor or whether you've worked a long time and you have insurance. If I have to put out a whole lot of money going forward on prescription drugs, that is a non-starter. And so if you can answer those questions, because those are really, I think, important questions to seniors, the people who work every day, and the people who have to have prescription drugs. They need to know that if we move forward with this, that their quality of life will not go down even more so because we make this happen.
Before any response,